I think what came first for me and for recovery was seeing the need in our own home, and also at times being afraid to speak about it, the stigma of it and what that looked like.
My addiction really jumped off at the end of high school. I started drinking in high school, and I didn't really think too much about it.
And I wonder back if when she was in the 7th, 8th grade when it started, if we had had places available and treatments available and people to talk to her, whether this might have helped that situation.
The thing I miss most about her is her love. The way she could light up a room. She could make a person that was having a rough time feel like the most important person in the world. I miss that she's not here to see her grandkids.
1 in 4 adults suffer with mental illness, 1 in 5 youth suffer with mental illness, and typically from the time someone shows symptoms, it's 10 years before they're actually diagnosed with a mental illness.
By the age of 21, I was in and out of rehab and also Marion County. 23, I was back in rehab. 25, I had a DUI. And in between all of this, I had multiple car wrecks, lots of overdosing, alcohol poisoning.
It's the most evil thing I've ever seen. It took the most positive person, strongest person in their faith I've ever met.
I think the thing you realize pretty quickly is this affliction crosses all socioeconomic boundaries. It affects people, rich and poor, white, black.
It's our friends and family, you know, it's our business owners. It's a friend of mine that volunteered a year ago to be on our committee to raise money for this campaign that took his life in January.
One of the things that you realize pretty quickly when you get involved in this discussion is that the capacity of the system is really lacking at this point.
The help available to seniors for mental health and addiction is not where it needs to be. There aren't enough people who specialize in addictions for the older population.
We're getting phone calls now that might be, you don't want to miss one because they may be suicidal. We don't have all the staff that we need to be able to have someone next to this phone 24 hours, 7 days a week right now, to be able to even service the people that are calling in.
We don't have the providers, we don't have the counselors, we don't have enough focus in our schools, we don't have enough treatment for someone with substance use.
It can be extremely frustrating to have someone say they're ready for help, but there are no services to help them.
We went to the emergency room 3 or 4 times, knowing there's nothing they could probably do, but we didn't know what else to do. We just wanted help.
So our campaign will raise $3.5 million to increase the care for mental health and substance use treatment in our community. To add 2 healthcare navigators, 10 licensed social workers, additional counselors in our schools, and medication-assisted treatment for our individuals suffering with opioid use.
And having trained, true mental health providers available that can interact in that situation as early as possible is absolutely the best thing that a community can have available to them.
So your gift to this campaign is going to make this care for mental health and substance use available to our families for years to come.
Today, I'm grateful for that because I'm able to speak across the line and sit across from another parent whose child may struggle with addiction or anxiety or depression, or know their self that there is hope out there and people really do recover from things.
Most of the time, the way people are behaving is not really who they are. They're trying to live through some pain they have.
This whole area is so important for the younger generation as well as a lot of our middle generation, that we've got to do something. Most things take money. This is no exception. And I would hope that you will consider in your gifting plans next year to be able to find a place that will help fund this work.
We have some of the best care for heart patients. We have some of the best care for cancer patients. People in the mental health area are just treated differently and viewed differently, and it should never be that way.
Can we as a community step up and do some things that maybe help those individuals have a better life, help those families have a better life? We can, and I'm grateful to see that the hospital is going to take an initiative to try to do that.